After hearing thousands of stories of people stressing out and seeing the direct toll it takes on their hearts, I felt compelled to help people find ways to effectively cope with stress. In fact, I often tell my patients that learning to deal with stress is as important as lowering their blood pressure, lowering their cholesterol, and even treating their diabetes. The reason it's so important to learn effective coping mechanisms is that when we ignore the signs of stress, we're less physically active and develop poor dietary habits. On the other hand, when we're aware of our stressful triggers and learn to effectively cope with stress, we're more likely to exercise regularly and even eat a balanced diet. So I set out to develop a solution and develop the Breathe technique, a 7-step exercise that helps reduce stress and heal your heart. Breathe combines 2 proven forms of relaxation therapy, guided imagery and breath work. Both of these techniques elicit the relaxation response, which is the opposite of the stress response. When practiced regularly, just like toning your muscles in the gym, you'll develop a special neural network that will help you focus and find a sense of calm when faced with one of life's unexpected stressful challenges. I have broken the process down into 7 sections. When taken together, spell out the magical word B-R-E-A-T-H-E. Breathe.
Breathe uses healing metaphors that emphasize the common theme of flow, which is a modern interpretation of several ancient disciplines. Prana is a Sanskrit word, which means breath, vital energy, and life force. The concept of breathing as it relates to circulating healing energy is in Greek as pneuma, in Polynesian as mana, and in Hebrew, ruah, which means breath of life. Your heart, a simple pump, has 4 components that work together synchronously to maintain blood flow to your body's tissues. Like an engine, each part needs to function properly in order for it to run smoothly and work efficiently. When a part of our heart has a problem, like the engine light in our car, we develop warning signs known as symptoms, telling us that our heart needs urgent attention. When using the Breathe technique, your deep breathing helps you entrain the nerves connecting the brain and heart, and should have a calming and heart rate slowing effect. This exercise will allow you to downshift and cool, much like an engine that needs to idle for a while.
We're starting to see the importance of what is mindfulness, what is being present, what is slowing down and downshifting, and how is that important in our workplace, which for me is the operating room, okay? And hospitals now are requiring what's called a timeout. And what that really is it's sort of like a big metaphor for the Breathe technique. We have to stop what we're doing, slow down. I have to go to the bedside of the patient in the operating room. I talk to the circulating nurse, I talk to my OR tech, I talk to the anesthesiologist, and we all talk about the patient. I say, I'm Dr. Kennedy, I'm the operating surgeon. This patient needs a pacemaker. I'm going to use the left subclavian approach. I want this pacemaker, I want this lead, I want this suture. We all stop and we focus and we visualize what we're going to do before we do it. We relax, everything's calm, we downshift. And then I go to the scrub sink. I personally do my Breathe technique and envision the whole procedure. And I envision from beginning to end, I see my patient in the office where I'm seeing their wound heal. And then I go and we execute. We do this every day.
B-R-E-A-T-H-E. Breathe.